New figures obtained by the ABC show more and more Australians are dipping into their super simply to pay for medical procedures. Political reporter Stephanie Dalzell has broken the story. She joins us from Parliament House in Canberra. Steph, good morning. So walk us through these figures.
Morning, Michael. So, first of all, there are specific circumstances where super fund members can go to the Australian Tax Office and apply for early access to their superannuation savings, and the ATO will approve that on various grounds or not approve it, and one of the grounds is compassionate grounds, and under that falls medical costs, so medical transport and medical treatment, for example. So if we look at figures back in the 2011 financial year, the ATO approved the release of about $25 million for medical costs. But if you fast forward to the 2020 financial year, the ATO actually approved the release of $476 million of superannuation savings for release on medical grounds. So that's about 20 times what it was a decade ago. And overall, if we look at the figures from July 2018 to December 2021, Australians applied to withdraw almost $1.6 billion on the back of 100,000 claims. So health experts say it's outrageous that Australia is meant to have a universal healthcare system and people shouldn't have to be dipping into their retirement savings to pay for medical treatment. We heard from the AMA President Steve Robson a short time ago. Take a listen to what he had to say.
Tells us we're in a situation where many Australians feel that they cannot obtain the medical care, whether it's operations or medical treatments that they need, without resorting to withdrawing money from their super. And I think that should be a big red flag for the system, for us to examine what sort of treatments that they're having and why they can't get them at the moment without having to raid their super.
So, Steph, why are people withdrawing money from their super to pay for this range of medical treatments?
So the reasons vary, but common reasons include things like dental treatment. Dental, of course, isn't covered by Medicare, and also things like bariatric surgery and IVF. Both of those do have a Medicare rebate, but there are significant out-of-pocket costs that are shouldered. But doctors say what we're increasingly seeing are people dipping into their super to pay for elective surgeries in the private system because of huge waits in the public system, which is, of course, under even more pressure as a result of the pandemic. Now, one of those people is 37-year-old Canberra woman Natalie Dunn, who I spoke to. She has endometriosis, which is a condition where tissue that's similar to the lining of the uterus grows outside of the uterus. It can often be incredibly painful and debilitating. In her case, it's up in her chest. So she said that she coughs up blood sometimes, she's had collapsed lungs, and she's in pain almost every day. Now, she's had 3 previous surgeries, which she's paid for, paid tens of thousands of dollars, and now she needs a 4th that's going to cost about $10,000. And she says she feels like she has no other option but to dip into her super. Take a listen to what she had to say.
I've already had 3 surgeries that have cost thousands of dollars each, and with the cost of living at the moment, struggling to pay the bills as it is. So if you're living in pain, then you've got to make a decision about, well, I don't have the savings. Where can I get the money from? Do you draw down on your mortgage, or do you take money out of your superannuation? That's really the only option that's available to you if you don't want to put up with the symptoms you're experiencing.
Now, a spokesman for the Assistant Treasurer, Stephen Jones, says that the government has no current plans to change the rules around allowing Australians early access to their super on compassionate grounds.
Steph, great story. Thanks for joining us.